Hello and a very warm welcome to the first health webinar of 2021 brought to you by JKYog and Radhakrishna Temple of Dallas. A tranquil mind, increased energy, relaxation, and well-being are just an inhale and an exhale away. Our body breathes on autopilot. So why do we have to worry about how to inhale and exhale? Well, scientific research has shown that mindful breathing, which is bringing attention and awareness to your breath and learning how to manipulate it, is one of the most effective ways to lower stress levels and can deliver powerful mind and body benefits. To guide us on how to harness the power of breath for improved health and well being, we are excited to have with us today Dr. Nick Shroff. Dr. Shroff is a urologist, cancer surgeon, Yoga Alliance teacher, and healthcare consultant. He has practiced conventional allopathic medicine for over 45 years. He embraces a combination of yoga, mindful breathing, and holistic living aimed at improving an individual's overall health and well-being. Dr. Shroff teaches efficient breathing practices, which are fundamental during movement, yoga, and meditation. He blends his experience of conventional modern therapy with pranayama, teaching appropriate breathing practices that can be incorporated during sports such as swimming, golf, etc. Over the past 4 decades, Dr. Shroff is blessed to have received guidance from several yoga masters, physician colleagues, and scientists. He was inspired to share this talk today after reading Swami Mukundanandaji's book, Yoga for the Mind, Body, and Soul. Dr. Shroff feels privileged to share his understanding of the multifaceted yoga philosophy combined with lifestyle modification as an adjunct to conventional medicine. A quick reminder, we will have a brief Q&A after the presentation. So if you have any questions relating to today's topic, do submit your questions in the chat window. With that, I am delighted to welcome Dr. Shroff. Dr. Shroff, thank you for joining us. Over to you.
Thank you, Ragini, for the good introduction. And thank you, Pooja, for all the technical details that you went through so patiently. And Shreya has always been in the background, and Dr. Kandalwal is there. Thank you, everyone, and welcome to you all. So I've been amazed at the innate experiential knowledge that some of our ancient Himalayan masters and Rishi Munis had, especially regarding proper breathing techniques. They had based their yogic knowledge, and now we are using science to validate some of their insights that they had, and they've been teaching it through for like almost 2000 years. So I've been blessed to learn from Swami Mukundanandaji and yoga masters, physician colleagues like Ragini mentioned, and several discussions with several research scientists. And I have shared some of my things that I learned in this presentation. So I've also incorporated some breathing exercises that athletes and swimmers and high altitude training people use. So I just want to focus this talk on breathing and how to calm the nervous system, especially the autonomic nervous system, the parasympathetic nervous system, and how to relieve stress, especially in this COVID era. Okay, next slide, please. Never mind. Okay, so let's look at the outline. I'm just going to go through some of these outlines. That I'm going to talk about faulty breathing habits that are currently available and talk about the pandemic era, and then how there are some science of breathing where you can intentionally breath hold and how it can help resonance breathing. And also I want to bring some wisdom of the East and kind of integrate this with modern science. Okay, so basically we're trying to come up with some proper breathing that brings better health. So this COVID-19 is like a magnifying glass. It has highlighted some suboptimal breathing habits. So I just want to give you a just overview of general breathing habits which have been highlighted during this COVID era. Okay, so one is mouth breathing. Okay, and that is definitely bad. Okay, the way to breathe is through the nose. Okay, that is one thing. And secondly, people overbreathe. They breathe more than 20 breaths a minute. That's not necessary. You know, that is called overbreathing. Okay, so we will go through some of these details, and there are so many dysfunctional breathing habits that leads to adverse health consequences. And if you think about it, breath is the most basic biological function. It is fundamental to body's physical and mental processes. So it is right under our nose, and yet people give very little thought to it. If you think about it, if you're breathing 15 to 20 times a minute, it comes to about 20,000 breaths in a day. And yet, most people are not getting full benefit from this life-sustaining activity. The other problem is poor posture. Most people are sitting in front of the computer, hunched over, sitting on for the TV, watching on the couch, watching TV for prolonged periods. And that can also have serious repercussions on your health. Okay. So we'll just talk about all of that as we go along. And I want to kind of let you know that mouth breathers have this huffing and puffing sometimes, you know, because as they walk and if they're not in a good shape, because they have difficulty breathing through the nose. And besides that, mouth breathing can cause gum disease, bad breath, snoring, sleep apnea, all these problems also. And the other problem is that most people are having short breaths, shallow breaths, and irregular breathing, and they breathe from their chest. So as soon as you tell them take a deep breath, they go up like this. They are using their chest muscles, the accessory muscles. And instead of that, they should be using the diaphragm. Okay. So my next slide. Sure. So in the COVID era, besides all these other difficulties that we talked about, there are some special things with upper respiratory tract infection, nasal congestion, running nose. People have inflammation, and that causes dry cough and sore throat, and there is shortness of breath, chest tightness, and that's primarily because of bronchospasm, which is this constriction of the bronchus, you know. And because of all this, there is low oxygenation and blue lips. And it is fair to say that COVID-19 targets the lungs, and in severe cases, it can go on to pneumonia and acute respiratory disorder syndrome, distress syndrome. Okay, so there are underlying medical conditions, and that might increase the risk. For example, hypertension, obesity, chronic obstructive pulmonary disease, diabetes mellitus, chronic kidney disease, stress, weak immunity. All of these comorbid conditions can cause more problem. And especially in today's date, I had this quote here saying, fast-moving virus, slow-moving vaccine, and a not-moving healthcare system. Or you can just say a very slow healthcare system. In fact, a lot of people are thinking that we don't even have a good healthcare system. We only have a sick care system. And we need to address some of these as we go along. Okay, so one of the comorbid conditions, one of the pre-existing conditions is chronic obstructive pulmonary disease. I just want to kind of elaborate a little bit on that. And that is primarily emphysema and chronic bronchitis, and sometimes severe asthma also. So in emphysema, there is destruction of the air spaces. These are called alveoli. You see, can you all see my pointer? So this is the alveoli, and this alveoli is damaged or destroyed, and therefore oxygen and carbon dioxide exchange does not take properly. And the person is coughing, wheezing, and she is gasping for breath. This lady here is sitting on the chair, she's gasping for breath. And this is the typical tripod position. So that's about emphysema. The other problem is that bronchitis, that's because of increased mucus and inflammation. Now, a little bit of mucus is necessary, otherwise there's a very dry throat. But in bronchitis, there's excess of mucus, and we'll talk a little bit about that in the next few slides. So now, quality breathing. So what do we need to do? How do we treat that? Now, if you look at this quote, it says, nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. Nobel laureate Marie Curie mentioned that. But I would add to that that now we need, in this time, we need to be fearless. And with efficient breathing, we should be fearless. Okay? If you do all these other things properly, and if you have some luck on your side, of course. All right. So first of all, we need to proactively treat chronic obstructive pulmonary disease that we talked about, asthma and allergies. Exercise, yoga, and appropriate breathing will trigger the parasympathetic nervous system. So the autonomic nervous system is divided into sympathetic and parasympathetic. The parasympathetic system, and we'll talk a little bit more after about this, it's a rest and digest. Rest, repair, and digest. There are simple things we can do before we do any big other breathing exercises. One is steam inhalation, and then tapping, proning, and humming, and saying Om. These things also help with breathing during the COVID era, especially during the COVID era. And one of the things is the steam inhalation decreases the excess mucus. And also there is a saline nasal spray or Jalneti. We use Jalneti all the time, at least once or twice a week, and that helps. One other breathing treatment against resistance, like blowing up a balloon, helps, and that is called pursed lip breathing. And in my next slide, I'm going to show you a little picture of this. So basically what happens is you inhale through the nose, a short breath for 2 seconds, just like you're smelling a flower. So it's not a heavy breath. It's just a light breath, just a short breath for 2 seconds. And then you exhale slowly for 4 seconds through puckered lips, as if you're blowing up a balloon. So one of my friends who is a pulmonologist, a lung doctor, he showed me this picture, and I'm sharing this with this permission, that this P2 is the alveolus. This is the pressure in the lung sac, in the air sac. And P1 is where the lip is. See, we are now talking about the differential pressure because there is resistance in the expiration or exhalation. See this? Because of the mucus formation here. Because there is constriction. So by breathing against resistance, we are expanding the air sac, and we are trying to keep them open. This is very important. This is a take-home point that you need to do, is breathe against resistance. This also helps to strengthen the lungs, and it is a treatment for chronic obstructive pulmonary disease and asthma and bronchitis. So in the very beginning, we talked about mouth breathing, which is a faulty breathing. The reason is mouth is for breathing and nose is for breathing and mouth is for eating. That's what we are talking about. That's the problem. And why? Because the nose can filter, warm, and humidify the air. The cilia in the nose, they can defend against the virus, bacteria, and fungi. And also by nose breathing, you're increasing the airflow resistance. If you look at this picture here, there is, and nature is very conservative. See how much of space, it's not only the nose, but all the paranasal sinus and all of that. So if you breathe through the nose, the air is going through all these turbinates and the cluncae, all of this, and all the way down into the trachea. Whereas if you breathe through the mouth, it goes straight out. So there is no defense against virus. The air is not filtered, not warmed, not conditioned. And also with nose breathing and slow breathing, you can activate the parasympathetic system, and that will help oxygenation and carbon dioxide exchange. And it will also increase the nitric oxide. We will talk a little bit about the nitric oxide in just a minute. So slow breathing, we talked about increasing the resistance with slow breathing through the nose. And slow breathing this is the most important thing to learn. Breathe light to breathe right. It kind of rhymes, right? So a healthy mind has an easy breath, and that's our Rishi Munis have been talking about it for at least 2,000 years, but people have now gone into all the other ways, and they're heavy breathing and fast breathing, shallow breathing. So this is not correct. So if you have a nice, good, slow breathing, that will help to increase the carbon dioxide. It'll increase the oxygen absorption and also oxygen in the tissues. That's where we need. That's how we are kept alive. And that's how the oxygen can get to the tissues, the muscles, the heart, lungs, brain, everything. And this will, by slow breathing, will stimulate the vagus nerve. And with that, there is decrease of peripheral resistance, so the blood vessels dilate. And of course, it'll calm the nervous system down, relax, sleep, all of that. And it will decrease the cortisol, which is the sympathetic system. Okay, so I'm going to focus a little bit on this part now. So we talked about nose breathing, and we talked about slow breathing and light breathing. The other thing important is the diaphragmatic breathing. So what happens is, you see this person who's lying down, even children should be taught this. So if you have a very young child, you can put a teddy bear on his belly, or you can put a book and make sure that the book goes up and down. And with diaphragmatic breathing, it is important to realize that we are not just breathing just back and front, but you're breathing circumferentially. It's a 360-degree breath. It goes all over. So instead of putting the one hand on the chest and one on the abdomen, you can put both hands on the sides, on the side, lower ribs, and see whether your abdomen is distended like a balloon. So you need to distend the abdomen like a balloon, and that will help physical, mental, and spiritual health. So it is a completely abdominal breath. Okay? And if you sit tall, the posture is very important. See this girl here, this animated thing, this girl is sitting tall. That's very important. Or even if you're sitting in Sukhasana or on the floor, you can sit tall. You have to sit tall. Only then, and you have to feel as if a little string is attached to your head and is pulling you up. That's how you can sit tall. And the good posture helps lung expansion. It massages the heart, the abdominal organs, and the lymphatics. So if you think about it, the lymphatics, there is no, that by movement and by diaphragmatic breathing is the only way the lymphatics can go up your abdomen, and the abdominal organs also massaged. And with this diaphragmatic breathing and slow breathing and quiet breathing, in rhythm will increase your performance and energy. So breath is energizing. So this is the correct posture. I won't belabor this point, but basically, you're sitting, since we are spending 8 to 10 hours, many people are spending on the computer, instead of being hunched over, you need to sit straight and see how it is. See, if you look at this, the spine is straight neck, and then the hip and knee is in one line, and also the knee and the ankle is also in one line. Yes? Okay. Now, so we talked about the autonomic nervous system being in the sympathetic and parasympathetic. The parasympathetic system is activated by nose breathing, slow breathing, diaphragmatic breathing, yoga, meditation, humming. We talked about all of this and the cold shower. So if you look at the vagus nerve, it is the longest nerve in your body, and vagus is called vagabond. So it starts from the brain all the way down into your abdomen. Through the diaphragm, it goes into the abdomen. So it supplies the bronchus, the lungs, the heart. It slows the heartbeat. It stimulates peristalsis, stimulates bile, kidney, contracts the bladder. All of these things it does. Okay, and the way it does this is it releases acetylcholine, which relaxes the blood vessels and decrease the peripheral resistance. So what happens is that will decrease the blood pressure and decrease the heart rate. Yes. So one of the most important books that I read while for the last several years I've been reading all this is The Healing Power of Breath. And this is a game changer, you know. The doctors Richard Brown and Patricia Gerber are two psychiatrists in New York, and they are neuroscientists actually. And they came up with this coherent breathing, and the ideal breath is 4 to 6 breaths a minute. But most people breathe at least 3 times faster. Most people breathe 15 times a minute. So the idea is to come down, you know, and the way to do that is by heart rate variability. That means the measure of variation in time between heart rate. So what happens is when you inhale, the heart rate goes up, and when you exhale, the heart rate comes down. So that difference, the measure of variation is between these two. So if they do a cardiogram, it's between those two spikes, you know. So that is what is called heart rate variability. And people who are in good health and athletes have a high heart rate variability. So one of the things that we need to do is, if you have a slow, light breath and diaphragmatic breath, nose breathing, and you come down to 5 breaths a minute is ideal. Then you can synchronize this with breathing, and it will also increase the parasympathetic tone. So if you see the speedometer here, it's like a speedometer. The green zone is at 5. Can you see my arrow? It's right at 5. Whereas when you go beyond 20, it's in the red zone. Okay. Now, some of our yogis and Himalayan masters, they used to have breaths even less than 5. They could have 1 and 2 breaths a minute. You know, I mean, that's really good. You know, that's maximal coherence. So the way to do this is you breathe through the nose, and you inhale for 6 seconds. So it's 2, 3, 4, 5, 6, and then you exhale 2, 3, 4, 5, 6, and you repeat the cycle. So it is nose breathing. I generally keep my nose inhale and exhale, but at least during inhalation, you do need to breathe through the nose. That is for sure. Okay. So if you look at that, this is just an extension of the previous slide. So this is called breathing patterns. And if you see normal breathing, okay, so most people have this breath, which is normal breath is 12 breaths a minute. Let's say a person has 12 breaths a minute. Okay. So each breath, let us say he breathes in, air is 500 cc. So 12 5s are 60. Okay. So 6 liters of air he's taking in. Okay. If that is good. Okay. But anything more than that, if you're huffing and puffing, and if you're sick, then you know you're breathing 18 and 20 and 25 times a minute. And then you're breathing in much more air. It's like, you know, gulping much more air. And then people go with 30 breaths, you go more, even more. And one of the other thing is that a person should be able to hold his breath for an athlete, and a good healthy person should be able to hold his breath for 40 seconds. And that is called the control pause. Normal control pause is 40 seconds. And that is a body oxygen level test. It's called a BOLT, B-O-L-T. It's body oxygen level test. And the next slide shows how to do this. Okay, so this is called an intentional breath hold. So you take in this breath in, you breathe out, and you hold the breath for maybe 4 seconds, just because we are in remote control, we are on due. And then at the end of the 4 seconds, you inhale and then normalize the breath. This is called a control pause, and this creates a mild air hunger. That increases the carbon dioxide, and that's very necessary. So a lot of people think that breathing, you're just taking in oxygen and you're just eliminating carbon dioxide, which is a waste gas. That is not entirely true, because carbon dioxide, little bit of carbon dioxide is necessary because it does help the pH regulation. The normal blood pH is 7.34. So that helps there. And it also helps to increase the nitric oxide, and also the carbon dioxide dilates the blood vessels. Okay, so this is a little bit chemistry, but I'm just trying to tell you this. And the book that I have read several times is this Patrick McEwan's. There's got a book called Oxygen Advantage. And his guru was Buteyko. Buteyko was a Russian scientist, and he had treated, he and his clinic had treated hundreds of thousands of patients with asthma and chronic obstructive pulmonary disease by just helping with the breath hold. And if you go one step more, even 2000 years ago, our ancient Rishi Munis, they knew about this. So they were talking about inhalation, which is puraka, and then they retain the breath, it's called kumbhak, at the height of inhalation, and then exhalation is rechak, and then it's called bhaya kumbhak, that is at retention. So the modern science is validating now that in rechak kumbhak, which is here, right here, where my arrow is, if you can close both your nostrils and hold your breath for a few seconds, that's called the control pause. And then gradually you can increase it over several weeks, but do not cause any stress, because if you hold your breath too long and if it causes stress, then that is defeating the purpose. In fact, our Anulom Vilom, our alternate nostril breathing, describes this very well, because there are several ways to do this. There are several variants of this alternate nostril breathing. And if you want to increase your carbon dioxide, which is very essential, it's a catalyst for the oxygenation in the tissues, and increase the nitric oxide, and we'll talk a little bit more about the nitric oxide in the next slide. But I do not want to do this if person is, we do not want to hold the breath if a person is pregnant, has hypertension, has heart or lung problems. Okay, since we are doing this online and remotely, if you have any of these conditions, you should not be holding your breath. Now, if you can follow with me, normally the alternate nostril breathing, the simplest way to do it is you close your right nostril, you inhale through the left, then you close the left nostril, open the right side, exhale through the right side, and then again inhale through the right side. So you're going to inhale the same side that you exhale. Okay? So basically, one more time, you're going to close the right nostril, inhale through the left side, close the left side, open the right nostril, exhale through the right side, and again inhale through the right side, close the right side, and breathe out through the left side. That is the simplest way to do it. But the way scientists are now telling, and pulmonologists and research scholars are now telling us, is that we need to inhale through the left, You can follow along with me. And then count 2, 3, 4. Close the left nostril, open the right side, and exhale through the right side, 2, 3, 4, 5, 6. Now close both nostrils. Hold, count 2, 3, 4, and then inhale through the right side. Now you're going inhale again through the right side, and then exhale. Okay, that finishes the one cycle. So the only difference here is you're counting 2, 3, 4, inhale. Exhale is always longer, which is 2, 3, 4, 5, 6. And then at the end of exhalation, you're holding the breath. It is just like in the previous slide. Here, we are holding this breath here. See, we are holding the breath here. We are holding the breath, and then we are again going up. Okay, so this is one of the biggest things that they have talked about, and they were amazed that the ancient Rishi Munis were doing this so well, and that people had taught this. But in order to simplify things, some of the variants of this alternate nasal breathing is not practiced now. They're doing only the simple form. They're not holding the breath at the end of exhalation. One other thing is that we do Brahmari. You know, Brahmari is the humming bee. So you inhale from both nostrils, from the nostrils, and exhale from both nostrils with the humming sound from the throat. Okay, so you inhale for 5 seconds, exhale for 10 seconds. The exhalation is always deep mode. And then the next stage is, that's the simplest version. Then the next stage is you, just like this picture here, you put the 2 index fingers, you close the ears to enhance the vibrations of the humming sound. So you just close and open, close and open. This is called the tragus. This is the part that here you can do that. Okay? And what happens is it oscillates the airflow in the nostrils and the laryngeal wall and increases nitric oxide. The Sanmukhi is just a variation of the Brahmari, where you're closing all the 7 doors. So 2 eyes, 2 ears, 2 nostrils, and 1 mouth. So you're closing, Sanmukhi means 7 doors, and then you can direct yourself inside. But the key for this Brahmari is the humming sound increases the nitric oxide by more than 15 times. They haven't found anything else. There is no medicine that increases nitric oxide by 15 times. That according to this rope. And why are we talking about nitric oxide? Because in 1998, 3 people got a Nobel Prize because they found out how nitric oxide works in the tissues. So very briefly, I don't want to get too technical, but nitric oxide is produced in the nose. That's why we talked about nasal breathing. Then it's produced in the paranasal sinus and the lung cells. Nitric oxide is a bronchodilator. So it is especially necessary during this COVID area because there is constriction of your bronchus. So just like carbon dioxide, this nitric oxide also will dilate your bronchus, and that will increase the ability of your lungs to breathe. Okay, so nitric oxide is of course virucidal also. It kills viruses, bacteria. It increases the cell growth modulation. There's a lot of things it does. It's one of these wonder things that is happening, wonder chemical. But so if you see this nitric oxide and oxygen, it goes through the alveolus, which is the air sac, and then of course here. And I don't want to get technical, but this is how Viagra was found. Louis Ignarro was the Nobel laureate, and Pfizer came and made more than $2 billion on Viagra. This is how the Viagra works, on the smooth muscle where the nitric oxide works, So that's just to show you. And of course, most of the doctors will understand how this works very easily, But let me just go on, press on. So we talked about the biomechanics of breathing, where you need to sit erect. And of course, yoga tells us all of that, all the postures in yoga, we talk about biomechanics. But now modern day science is emphasizing more on the biochemistry aspect also. And I think the Rishi Munis innately knew about it. The Himalayan masters, they knew about somehow this thing inside, but they did not know what was the biochemistry of this thing. It was not until 1904 that Christian Bohr found this, discovered this, talked about it, which is called the hemoglobin oxygen binding capacity. So in the simplest way I can tell you is that normal pH of the blood is 7.34. Okay, so in the tissues, in the muscle and in the tissues, the exercises causes increase of carbon dioxide. The carbon dioxide with water forms carbonic acid. So this is an acid and it decreases the pH. Because it decreases the pH according to the Bohr effect, that will unload oxygen in the tissues. Okay, that is how the oxygen is unloaded in the tissues. And in the lungs, it's the other way. So what happens is that carbon dioxide, we talked about why the carbon dioxide is important. Carbon dioxide is decreased there, so it increases the pH. And then because of that, the hemoglobin picks up the oxygen in our blood in the lungs, and then it is transported to the tissues. So basically, this is the mechanism for, it's called oxyhemoglobin shift to the right, shift to the left, all the details. But I'm just telling you basically what happens is in the tissues, there is, because of the acidic pH, because of the carbon dioxide. Okay, I think, okay. And now we come to something a little bit more of yoga, what they talk about in yoga, and philosophically they talk about that the breath is your only connection between body and mind. So there is the body here, and mind is the kite. The kite is in the breeze. So the breath is the string of the kite. So the string is the only link between the mind and the body. So when the wind, because there's increased wind, the kite is flying off. It's going in the past and the future. So past is regrets and future is fear. So you need to be in the present, and the breath is the one that keeps you in the present. A lot of people say that past is history and future is mystery and present day is victory. Presence is victory. Okay, so Thich Nhat Hanh, is a Buddhist from Vietnam, and he talked about it very nicely. He says, feelings come and go like clouds in a windy sky. Conscious breathing is my anchor. If you want to conquer the anxiety of life, live in the moment. So all we are talking about in yoga, in mindful meditation, when we do our meditation, is to be in the moment. Even when we observe our breath, we are saying, okay, watch the inhalation, watch the exhalation. We are saying we are living in the moment. So body and mind, although we are talking about interconnection, really speaking, your mind is not in the brain. It is in every cell of your body, the mind is there. So body and mind is all one. It's one continuum. They're not two separate things. Okay, so here, so look at this. This is mind. We need to be mindful. Let's focus on the blue. Mindful. And we need to have a quiet mind. Okay, and see this girl here in blue? She's got a beautiful, mind is not cluttered. It's a quiet, happy mind. Okay, whereas see this, the flip side, the mind is full, full. Here there is a traffic jam. If you see this here, the mind is cluttered. This is called a monkey mind. Mind is completely cluttered. Okay, this is called digital information overload, DIO, digital information overload. Okay, and this FOMO is this thing, fear of missing out. That's why people are so much stuck up in their WhatsApp and all their things, Facebook and Twitter and everything else. So, and then NO is no mobile. My God, if you have a teenager and the mobile is not there, I mean, they freak out, Even some adults do it, of course. And DMN is, default mode network. So we are always in default mode network, no mobile, FOMO, DIO, which is digital information overload. And that's why there is a traffic jam. And the way we need to be is just balance of mind. Okay. Okay. So in an effort to simplify this, I mean, the whole thing, there's so much of biochemistry, chemistry, all kinds of things. But in an effort to simplify it, there's an acronym for mindful. And mindfulness is paced breathing. So we are tying the breathing to the mindfulness also to lead a meaningful life. So M is moment to moment attention. That means you are in the here and now. N is non-judgmental attitude. So one of the things is when somebody is talking to you or you're listening to somebody, whatever it is, be totally non-judgmental. Only then you can learn, right? And then detach from unhelpful thoughts, because if your mind is in the present, then you're not thinking about anything else. Because remember, the brain can only do one thing at a time. Okay? So if you're doing 3 things at a time, then you're stacking them up. The brain is doing one thing and then going to the next one and then coming back, which is very inefficient. So detach from unhelpful thoughts. Then, of course, forgive and be grateful. So this grateful is very important because, if you forget and forgive, only then you can be grateful. And then only you can be in the present mind. Then only you can be mindful. And unconditional acceptance. So we're not talking about tolerance. It's not like me tolerating you or nothing like that. It is unconditional acceptance. And then mindful. So L is learn with a beginner's mind. If your cup is already full, then I cannot tell you anything. I cannot teach you anything. No guru can also teach you anything if your cup is already full. So we always talk about guru teaching you something, but this is so. John Kabat-Zinn had written a beautiful book, and I recommend you to read this, Mindfulness-Based Interventions. It talks about the past, the present, and the future. It's very, very nicely written. And so this is one of the things. I want to just spend one moment on gratefulness, gratitude. Everybody talks about attitude with gratitude. In this COVID era, there was a patient who had COVID-19. He was in the hospital. He was in the hospital for 10 days. And this is based on a true story. I'm just not giving names for, but 10 days he was in the hospital. When he came home, after a few days, he got a bill of $200,000. So he was crying, and people said, "Oh, we'll help you with the bill," and all that kind of stuff. And then he said, "No, it is not that." He said, "I'm 60 years old. All these 60 years, God has given me free breath. And I've never been grateful for that. I've not had that attitude of gratitude, So whatever Swamiji does for you, or whatever, anything somebody does for you, your guru does for you, or temple does for you, be grateful. Have this attitude with gratitude, right? So this is my penultimate slide. This is just a summary. And this is another acronym. Just nose, just because we talked about nose, we talked about breathing is right under your nose. Okay. So nose breathing is N is for nose breathing. So remember that. Okay. No mouth breathing, no matter what. In fact, when I walk, even when I jog a little bit, I don't jog too much, but whatever I do, a little bit of jogging, I always close my mouth and jog, never open it. Okay. Even the days when I played racquetball in the league, I played a lot. For whatever reason, I didn't know this much about the biochemistry and all that, but I kept my mouth closed. That is always good because then it will help your oxygenation better. And N is for nitric oxide. We talked about how the 3 people got a Nobel Prize for this nitric oxide, most important gas, especially in coronavirus. And O is for observe. So, you need to observe. People always tell you, you feel the air coming in through your nostril. You feel the inhalation, you feel the exhalation. This is awareness, this is consciousness, most important. And ocean breathing is, of course, the Ujjayi breathing. So that also helps to decrease the resistance, of the breath. Most of the yoga people know about ocean breathing or Ujjayi breathing. Ujjayi means victory over the mind. So that is ocean. So that decreases the resistance of the air as it goes through the nose and comes out because of throat restriction. Then S is for slow. We talked already about slow breathing. Remember, it has to be a long and slow breath. Okay, long breath and slow breath, not a heavy breath or not a fast breath. And it should be smooth. It should not be jerky. It's a nice, smooth breath. And that is the only way you can be stressless. I can even take out the space between the stress and less, and it is still one word, which is stressless, completely stressless. Okay. The other thing is that we talked about is when you inhalation should be short and exhalation should be prolonged. That is very important, because if exhalation is prolonged, then it goes into the parasympathetic system, which is the rest and digest. And that's your way to recover. So exhalation. Most people think that it should be double. So if you're inhaling for 4, you need to exhale for 8. But minimum to start with is 4 and 6. 4 exhalation, count 4 to exhale and 6 to exhale. Now, emotions also are tied to breathing, right? Because if you're happy, you're nicely breathing, you have a slow, smooth, nice breath, and that's emotions. And it is bidirectional. So if you're angry, then automatically your breath will also become fast and jerky and all that. Okay. Then of course exercise helps, to be with the carbon dioxide. It helps to get some carbon dioxide tolerance. So then that way you can hold your breath longer and you can enhance your lung capacity. And then of course energy. When we talk about energy, this is prana. This is life force, subtle life force. So the professor of integrative medicine, Andrew Weil, has written a very nice book, and it's called he says, changing your breathing patterns can affect and improve you mentally, emotionally, and physically. He said that if he has to teach one thing to his first people that he teaches, if he has only one thing to teach, he will teach about breathing. And that's what we are trying to do here. I'm sharing whatever I learned from these people and doing it practically too. Because there's a proverb with breath is life, and you breathe well, you will live a long life on earth, long and happy life. Okay, and this is my last slide. So be breath centric. So you need to be breath centric. And what we need to do is to decrease the turbulence in your listening. See this turbulence? This on the left, on my left side is turbulence. So that is causing distraction. It is causing stress and tension. So we need to decrease the turbulence and decrease the distraction, decrease the stress, decrease the tension. And see the picture on the opposite side is nice. There's tranquility. You have to allay apprehension and restore tranquility. That's what they say all the time. So you need to calm down and relax. You're totally relaxed. See how nicely the water is. And you see the blue skies. This is what that Thich Nhat Hanh was telling about, that blue skies. So there are clouds there. And if you think about it, that our self is the blue sky. And there are clouds and all this thing in front of it. So beyond all these clouds is our nice blue sky, which is our inside self. Okay, this is our innate body, which is pure. Okay, thank you all, and over to Ragini.
Thank you, Dr. Shah, for an excellent presentation. It is fascinating to see how the breath, mind, and body are interconnected. We will now dive into Q&A. So you mentioned about stimulating the vagus nerve. So how can you stimulate the vagus nerve, and what is the importance of the vagus nerve in breathing? Dr. Shroff, are you able to hear me? Dr. Shroff, are you able to hear me?
He probably will join back in. I see he's got disconnected. He's probably having computer problems. Okay. In the meantime, I think we could take a few minutes for announcements, Ragini ji. What do you think? Or else we can just wait for him for a couple of minutes. Okay, I guess we'll just do a couple of announcements and hopefully Dr. Shroff will join back and answer all of our questions. I have reached out to him. Maybe he's having technical difficulties. Okay, so so go off, Ragini can I make some announcements? Some really exciting announcements today.
Yes,
First of
I'm
all,
excited for that too.
we have a new book, Seven Divine Laws to Awaken Your Best Self. I cannot say enough about this amazing book that Swami Mukundanandaji has written. This has become my daily routine to read this in the morning. It is definitely a must read for all of us. They are available on Amazon. It is available on Kindle version if you are like me who cannot wait for it to be delivered home. That's exactly what I did. I pre-ordered it and I started reading the Kindle version. It's a treasure of knowledge, amazing practical tools, seven beautiful divine laws. Definitely a must buy, and buy a few extras. You'll be helping out your friend if you give it to them. We have two more announcements. We have Dr. Shroff back online. We'll make two more exciting announcements right after this.
Dr. Shroff, can you hear me?
You have to unmute yourself. Yes.
Okay, can you all see me now? I'm sorry. I got.
Okay, we're happy to have you back.
Okay, sorry, yeah. Okay.
Okay.
So,
We'll dive into Q&A now. Is that okay, Dr. Shroff?
yes, I'm fine. Yes, absolutely. I'm
Okay.
fine. Yeah,
Uh,
something happened. I got messed
no
up.
worries. Okay, so the first question is you talked about stimulating the vagus nerve. So, how can you stimulate the vagus nerve, and what is the importance of the vagus nerve in breathing?
So the vagus nerve is part of the parasympathetic nervous system, which is the autonomic nervous system. So you have to realize that autonomic is automatic. That's true. It's automatic, but you also have conscious control over it. So you can regulate it, you can control it. And we want to go into the parasympathetic nervous system like we talked about because the body needs to go into the rest, repair, and digest mode. So what happens is when you're in the parasympathetic mode, you need to lengthen your exhalation. So short inhalation and lengthen the exhalation. That's one way. That'll relax your blood vessels. Okay. And then meditation helps. Meditation, singing, humming, chanting, cold exposure like diaphragmatic, that helps. And also neck massage. If you massage the neck on the right side, so the left side is deep, the vagus nerve is very deep, so you cannot do a neck massage on the left side. But on the right side, you can do that, but you shouldn't do it unless you're with somebody who knows how to do it. So I don't want you to faint or do anything like that. Okay, and also food, like probiotics, can help. Omega-3 fatty acids also help.
Okay, so moving on to the next question. Carbon dioxide is a stale waste gas you mentioned. So, why is overbreathing, which is getting rid of all the carbon dioxide, bad?
So, overbreathing and this is called hyperventilation. So, it depletes the body of carbon dioxide. And we talked about it that the function of the breathing is not only to get oxygen from the air, but we need to let out carbon dioxide, but not all of it. So if you do overbreathing, like you're breathing 25, 30 times a minute, what happens is chronic overbreathing, what happens is your body gets rid of the carbon dioxide. Now, carbon dioxide is necessary. It is a catalyst. And that is the only way that oxygen carrying the hemoglobin, the red blood cells which carry the oxygen, can release the oxygen in the tissues. So the carbon dioxide is necessary as a catalyst. And the carbon dioxide helps, once the oxygen comes to the tissues, then it can go to all the muscles and body and brain and heart, everywhere that can supply that. So what is happening is that if you do continuous mouth breathing and chronic breathing, then it's a vicious cycle. You're huffing and puffing and you're losing more carbon dioxide. And you do need little carbon dioxide. Too much is not good, of course, that can cause problems also. But a little bit is necessary. Yes.
Okay, so my next question is actually related to the previous one. How does breathing into a paper bag help during panic attacks or anxiety?
So breathing into a paper bag, or you can cup your hands. You can cup your hands and breathe. So that helps because the bag contains the exhale. When you breathe out, it has carbon dioxide. And so when you want to rebreathe that carbon dioxide. So if you breathe into a paper bag, what happens is that the carbon dioxide that you let out, you're trying to breathe that back in. So it is restoring the lost carbon dioxide gas. So that's the reason. So once they come out of the panic attack and the anxiety attack, then you need to teach them, hey, listen, you need to breathe slow. You need to breathe light. Light is right. Light breath is right breath. Slow, then it's a gentle breath and it's a diaphragmatic breath. All of these things will help. The other thing that will help once you treat them is hold the breath for 15 seconds. We talked about the breath holding part. And breathe through that pursed lip. So it's like blowing a balloon. So you just breathe in, take in a light breath, 2 seconds, just a light breath, and breathe out through the pursed lip, like you're blowing up a balloon. So that causes resistance, and it opens up the alveoli which are collapsed.
Okay.
One other thing is that when you're breathing into a paper bag, just because you see somebody you think that has a panic attack, just don't give him a paper bag, but be careful because there are several medical conditions like asthma and heart attack that can be confused with overbreathing because they are pending for breath. But really speaking, they have another problem. They have severe asthma. They have a heart attack or something like that, So then you'll make it worse. So you be careful. I mean, you just don't jump into a KOP. If you find out that is the reason for a panic attack, or if there's a doctor or some other health professional, then that is fine. Okay.
Great point there. Moving on. What is the reason for mouth breathing in kids? Is it enlarged adenoids, and can it be cured without surgery or other breathing techniques?
Yes. So, well, it depends. I mean, of course, if there is, so they go to the ENT doctor if there is a nasal septal deviation, or there is polyps in the nose, or there is blockage of the nose, then of course, but realize that the nose, whatever is happening in the nose is happening in the lungs also, because it's all one system. It's not two separate things. So they need to do that. But if they're chronically breathing, you can just see because of them, then you need to teach them how to breathe light, breathe slow, breathe diaphragmatic. And they have a thing called lip seal. So what it is that but for children, they have a thing that is, it just opposes the lips, but they can open the mouth anytime. It's Patrick McEwen, that oxygen advantage person, he has a thing called lip. It just goes around the lips. It's like one of these Joker, the curve. The Jokers, they have this thing, this curve. They have a little thing there. So that's what it. But this, otherwise, for adults, you can just put a little tape, surgical tape right over it. Don't use the duct tape or anything big, just a little tape over your phone. And there's a thing called Somniflex, that makes it also. That's this little thing that you can put on your mouth. So basically, you're not breathing, mouth breathing in the night. That is very important. In the daytime, you can just tell them, hey, listen, close your mouth and breathe. Even if they're having a mask, breathe through the nose. Remember, it's very subtle. And that also decreases, it's a slow breath.
Okay. What are some of the effective breathing techniques that help for relaxation, sleep, or yoga nidra?
Yes. So, first of all, you need to wind down and calm down. So many times people will do some relaxing yoga poses, before bedtime. It's not a heavy exercise, but little bending and all that, that'll help. Okay, and then of course you need to stop the tea and coffee after at least 3 p.m. After that, because it takes about 8 hours. The half-life is 8 hours. So if you're going to bed by 10 o'clock, it takes about 7-8 hours at least. So, and then light, blue light is not good. So there are glasses that you can get called blue light elimination glasses, or you can wear dark glasses, your goggles, your Ray-Ban glasses in the night, and when you're seeing movies or videos and going on the computer, Then there is a breathing thing called resonance breathing. We talked about the coherent breathing 6 times a minute. That's very important. That kind of thing is helping. Then humming is very good. That also helps you to sleep. So what I do generally is I do a little bit of yoga for 20 minutes or something like that. And then I do the 4-7-8 breathing, which is, you breathe for 4, you hold for 7 and breathe out at 8. And I do the, we talked about that breathe 5 times a minute. That means you inhale for 6, you exhale for 6. So that's 12 seconds. So 60 divided by 12 is 5 breaths a minute. So if you cannot do 5 breaths a minute, you start with 8 breaths a minute, come to 7, then come to 6, and then eventually you'll come to 5. That is your ideal breath to sleep. And then guided meditations will help. All of these things will help to just be calm. The important thing is that daytime and nighttime breathing, by practicing correct breathing in the daytime, it will boost your energy level, in the daytime. But at night, you need to be quieter, softer. And the goal is to get deep, peaceful sleep. And that will keep you relaxed for physical and mental health. Yeah.
Okay, great point there. How are Kapalbhati and Bhastrika beneficial, since they are both rapid breathing?
So here, our focus was here for COVID-19 and relaxation breathing, calm breathing and all that. I do Kapalbhati, but I do it in the morning. I do not do it in the night or anything else. Early morning, because that is to energize. That's like having a cup of coffee. That's it. That's your coffee breathing. Because you're breathing up. And so there are benefits of that for a short time. I don't do Kapalbhati very long. I do it for a short time, and that is helpful because you're doing this. Even Bhastrika, same way. And there is a person called Wim Hof. He teaches how to breathe heavy breathing like Kapalbhati for 30 minutes. And he says it increases the immune function and increases all kinds of things. But that is the different type of thing. The one I'm emphasizing is relaxed breathing, calm breathing, slow breathing, nose breathing, light breathing, diaphragmatic breathing. That's my focus.
Okay, so can you tell us how nose breathing and slow breathing help to increase the nitric oxide production?
Yes, so nitric oxide is present in the nose, in the paranasal sinuses, and in the lungs. Okay, so when you slow breathe, it gives the breath some time to absorb the nitric oxide. It's generated in the nose. So if you mouth breathe, you're bypassing all that. You're bypassing the complete generation of nitric oxide. So nose breathing is nose breathing filters the air, conditions the air, humidifies the air, warms the air, and because it's a slow breath, because there's increased resistance, it has to go through all of these turbinates and all that. It is very important to generate the nitric oxide. And nitric oxide is present in the lining of the blood vessels. Our average person has 70,000 miles of blood vessel in the body, 70,000. Okay, because these are blood vessels, the capillaries and all that. Now, what happens is the nitric oxide will dilate. It's a vasodilator, so it dilates the blood vessels. It decreases the blood pressure, so it calms you down. And it also increases the lung absorption capacity, oxygen absorption capacity. So it's a bronchodilator. All these things help with concentration, and so proper breathing is very important for nitric oxide level. So slow breath is important for health and fitness, and it increases the nitric oxide level. So the 1998, Three people got the Nobel Prize for medicine and physiology, and they discovered the nitric oxide role in cardiovascular signaling molecule. That is the technical term that they call it. But that is cardiovascular meaning in the blood vessels. That's all basically.
Okay, thank you, Dr. Shroff. I think we have time for just one last question. And can you elaborate a little on how the breath influences our emotions?
Sure. So breath and emotions are bidirectional. Breath and emotions. So different emotions are associated with different breathing forms. So by changing the breath, we can change how we feel. For example, if you're happy, you have joy, your breathing is nice, regular, slow, and nice diaphragmatic deep breathing. It's nice, Whereas on the flip side, if you're angry, your breathing is also irregular, short, fast, and shallow. You're breathing from chest, shallow breathing. So if you follow the breathing pattern associated with different emotions, you can feel those corresponding emotions. So it's both sides. If you're happy, your breathing is better. If your breathing is better, you're happy also. So changing your breath rhythm can signal relaxation. So when you change your this thing to a slow breath, then your body is telling you, okay, there is sympathetic. You don't need to fight. There's no tiger coming out of you when you come out of the cave. Everything is nice, relaxed. That stimulates the vagus nerve, and it will help you to calm down. So breathing in response to emotional stress like sadness, happiness, fear, all these things have very important thing. That's what I think. That's otherwise you get into the arousal state, which is not good. So your body has to be happy. So another thing is that if you're in the presence of somebody that you like, or you're smelling a rose, or you're smelling a baking bread, the rhythm is slow, rhythmic, comfortable, because your brain tells you, oh, this is a very safe place. We are safe now. So that kicks in the pleasurable emotional state.
Okay, with that, we come to the end of today's session. Thank you all for joining us. On behalf of Radhakrishna Temple and JKYog, I would like to express our gratitude and appreciation to Dr. Shroff for being here today and educating us on the science of breathing and giving us pointers to recognize dysfunctional breathing practices and how to practice efficient breathing. Thank you again, Dr. Shroff. Really appreciate it. And stay tuned for some exciting announcements. Pooja ji, over to you.
Thank you, Ragini ji. That was a really informative session, Dr. Shroff. Very, very insightful. Thank you so much. Like I was saying, first of all, we talked about the 7 Divine Laws book. And here's a second one that Swamiji has provided us. It is The Purpose of Life, a 21-day challenge. It started on Jan 1st. So if you go to jkyog.org/POL, if one of the volunteers can put it on the chat, that would be helpful. So it is jkyog.org/POL. So Purpose of Life, it is a 21 series video lectures, short, beautiful, to-the-point tips that Swamiji has given us. We've already completed 3 of them. One of them was released today. So every Monday and Friday at 7 o'clock on Swami Mukundananda YouTube channel. So put yourself a reminder and do not forget to look at those wonderful videos. And now my favorite and the most exciting one. I want to bring to you the attention to JKYog Music. It's a new channel that has been created only for bhajan lovers. So all the bhajan, so tomorrow there is going to be, on Saturday at 6:30 p.m., the first bhajan, Shri Ram Jai Ram by Swamiji, is going to be released on this channel. So do subscribe, JKYog Music. I have put the link on the chat, so definitely don't forget to subscribe to this channel. And I want to play this beautiful one.